Right. Coming to the application scoring for the general surgery. So this year, the maximum total, it's not 55, actually it's 60 because there are 5 score of a overall impression of the application. So there are 55 total score from the 7 questions and 5 score from the general impression. 288 is the interview capacity. This time the interviews will be conducted over 2 days rather than 3, but capacity is the same. They will just do more interviews each day. Who will receive the interview and who will not? It every year it changes, and it's kind of they pick up the top 288. Obviously, many people, not many, few people do not respond to the interviews, and they invite the further candidates to fill in the 288 slots. But there is no hard cutoff. Just a overview of the weightage of the score, and probably you can. So probably you can see that this year they have increased the weightage of logbook appendectomies. The weightage of the publications and presentations, like an academic work, together makes 1/3 of the whole application scoring. So last year, the audits did have a significant weight in application, but this year they have reduced that weight. And to be honest, that significant weight of the audit, 1/3 at that time, it was too much. So let's explore each question in detail. So general surgery experience, what they are asking is, by the end of July 26 or by the completion of core training, how many months full-time or equivalent, if less than full-time, you will have spent total in general surgery in any post-foundation years. So post-foundation means after FY2 or after internship. So post must include experience in both unselected emergency general surgery and elective general surgery. So they are getting more and more stricter in that, because earlier people did used to submit some of their experience in general surgery because they were covering on-call general surgery, but actually they were rotating, let's say, in orthopedics or urology. But now they have been very relatively stricter that it should be both elective and emergency general surgery to be counted as a general surgery. Please do not include any other post. Recognized surgical subspecialty means colorectal, hepatobiliary, upper GI. So, but if the specialty is separate, for example, vascular surgery, so that's not elective general surgery anymore. So that's very self-explanatory. You will get the maximum marks if you are around 24 months, like 13 to 36 months. If your experience is less, you will have lesser marks, but not too less, even if you have up to 8 months of general surgery experience. But more your experience goes up, lesser score. And if you have spent more than 5 years in general surgery, you will get 1 score. So what that means is, somebody asked question before, it's not a contraindication, but your weightage in the application will be relatively less. But you can achieve that weightage because of your experience in further questions, we will see, because obviously you would have done more things. So that's just the snapshot of the template, self-explanatory. You just need to tick and submit. Important thing is it's the post-foundation year and both elective and emergency surgery. What is more important, we stressed already in the application part, is whatever evidence you submit for your general surgery experience, your dates should be very clear, your start and finish date, and what kind of rotation that was, colorectal, general surgery, hepatobiliary, whatever that was, it should be mentioned into your contract. If it is not, then you will need to submit alternative form of evidence. You can get a letter, you can from the head of service or HR or any supervising consultant. If they can make a letter that you have been rotating this date start there, this date finish this, and your role was this, that should be sufficient. But make sure that you meet that criteria. Specialty rotations are excluded. It is full-time equivalent, means if you have been working less than half time or you have been on leave or something, then you can exclude that experience. Sometimes it's a gray area. It's not clearly mentioned it was less than full time, but you know it was less than full time. What I would say is look at your number of months and see where you fall. Whether making it a less than full time helps you or keeping it a full time helps you, and decide yourself. You can exclude long sickness or maternity leaves. If that's not helping you, then probably just leave it. So that's about the general surgery experience. Second question is appendectomies. They have increased the weightage of appendectomies. If you've done 36 to 70 appendectomies, you will get the maximum score. But important is these are the appendectomies that you have performed either supervising somebody else, performed yourself with supervisor scrubbed or unscrubbed. But if you were assisting somebody or you were observing, then it's not counted in this segment of the scoring system. So it should be one of those. Now look into your logbooks now. Transfer your overseas experience. There are certain gray areas where people can either put more or less, but make sure that this is in your consolidation sheet. It does matches your general surgery experience that you have mentioned. The dates match, and make sure that if in your logbook the appendectomies are more, but you are mentioning less, then this can be a significant issue. Whatever you submit, it should be evidenced by your logbook, and obviously your educational supervisor, they will review each page of your logbook, and then they will sign the top sheet of the, like a checklist. After reviewing each page of the logbook, then you will make each page of the logbook in the form of a single PDF document to upload on the Cupercon. If you have more than 86 appendectomies done, probably you don't need the training. That's what they think. So that's why they give the minimum score in this part. That's the logbook. So what the points are: full consecutive logbook evidence. Don't skip any evidence trying to play with the system that probably that is helping you. No. So if that is discovered, you will have the minimum score on that segment. Each page of the logbook, including cover sheet, where applicable, must contain a clearly legible signature, name, and GMC number or equivalent. Equivalent means it doesn't have to be a UK consultant. It should be a person who is a verifying supervisor. Logbook evidence must be congruent, no skipping. If the applicant has undertaken general surgery post where logbook evidence is omitted, minimum score will be given. Please ensure there are no gaps in the logbook evidence. If there are gaps in the logbook evidence you provide, then minimum score. But if there are gaps which are congruent with your employment history, there was a gap, then that's fine. So if your part of your logbook is outside the UK, I would recommend that transfer the cases to the elogbook.org. Supervisor who are not working in the UK, you can add them to the logbook, and then you can add the cases under their name, you performing and they supervising them. Third question is the audit. They have changed the audit to a single audit. They want a single audit now. So you got to carefully select your best audit, and it has to be a closed loop audit. Furthermore, they say it should be sufficiently novel. must have been presented, because they will ask you to submit the presentation of both first cycle as well as the second cycle. For each loop, you must provide evidence of the involvement in the design, execution, and presentation, which essentially the best evidence is your supervisor writing a 4 or 5 lines that you were involved in this audit, you designed it, you discussed, submitted, got the approval, you were involved in execution of the audit, data collection, analyzing the data, presenting, and then you were the instrumental in bringing about the change. And after that, again, in the second part of the audit, you were involved. So if you get, because no audit certificate from the department will clearly mention what role you were playing. But if you get the letter from your supervisor, then that is a significant evidence that what you have been involved in. And if you get it countersigned from the audit department, that's potentially non-rejectable sort of evidence. So if you meet the minimum criteria of the audit, for example, it's a closed loop audit, you've been involved in the whole audit, you have presented it, you don't have to present it, but the audit should be presented. If you have presented, that's the best thing. Even if somebody else presented, but you were involved, that's also acceptable. And it was a sufficiently novel audit. Then how much score will you get out of 8? It depends upon how valuable that audit was. What they will look into is the reference standard. What was the standard? Was it a solid standard or just a local guideline, or was it just a made up standard? What design was it? How important was the clinical questions for the ultimate patients? And what impact did it have on the work? So this will help ultimately for them to decide how many score you will get out of 8, provided you meet the minimum criteria. And what they have done this year is standard NHS mandatory audits. For example, operation notes, case notes audits, antibiotic audits, which are generally mandated, VT compliance audits, they will not consider those. Let's say you do not have any other audit, and your audit is related to operation or case notes or antibiotic or VT, what I would say is do submit that. But the first point, be sufficiently novel. What you need to do is bring out a novel component from your audit and present your audit in a way that it is not a standard mandatory audit. There is a novel component to that audit. For example, infectious, you are looking at the antibiotic, but bring out, let's say, something XYZ unusual resistance you were noticing, and then you started doing audit, and it's not a regular antibiotic compliance audit. So if you have any audit that falls into this category, you do not have any other audit, you have to submit that. I would recommend you do submit, don't skip, but try and bring a novel component to that audit. Quality improvement projects, probably because many of the quality improvement products do not have a closed loop, so they will be rejected straight away. So what I would say is, if you do not have any audit, but you have a quality improvement project, but that is a kind of a closed loop as well, then yes, submit that. But if you have any audit that is closed loop, I would prefer that audit over any quality improvement project. Audits do not have to be general surgery themed. You've done the audit in some rotation, you've done the audit in foundation year, just submit that. And there is no criteria that they will reject it. Generic audit must stress on the novel element. That's I stressed already. That's the template you will need to, each segment you will need to fill in. What I would recommend is the audit that meets that criteria, look at the positive points of your audit, and then highlight in your template those positive points. Just don't put the generic things. The whole point of template is they will be looking into template to mark you out of 8. So highlight your involvement, highlight the strong points of your audit. For example, concept and idea, you were actively involved. Planning, protocol, registration. If you had any registration other than the departmental registration, do mention that. Team management, you were kind of not collecting the data yourself, but you were kind of managing a team. That's a positive point, leadership point. Data analysis, results writing, brainstorming for possible interventions. That's a very solid point, that you looked at your data and brainstormed what could be the possible underlying reasons, and you picked up those 2 or 3 that you wanted to target as part of your intervention. So do mention that. Second phase, final results, and change in practice is the main important thing. Must highlight that what change your audit has brought, how the outcomes have improved, or how the statistics have improved. So that is, you must stress on. And I would say the audit that has actually brought about a change in improvement in clinical outcome, they will get more score onto this domain. Rotations, it's not very complex. What they say is that you need to have 2 rotations of at least 4 months in the subspecialties, which include pediatric, ITU, ED, thoracic surgery, ENT, neurosurgery, plastic, trauma, orthopedics, maxillofacial, vascular. So any of the 2. What happens sometimes is you have 3 months rotations, you do not have 4 months rotation. Then strictly speaking, you do not meet the criteria unless you have 4 months rotation. But if you have leeway, you can get a single certificate. Let's say you were rotating in, let's say, thoracic surgery, or let's say ENT and maxillofacial surgery, 2 months, let's say, for example. You can ask them to combine the 2 rotations and give you an evidence for, let's say, more than 4 months rotation. Or let's say you were rotating in partly in some related specialty, let's say neurosurgery and ENT. Potentially, you can combine these 2. So strictly speaking, it's not counted. But if you get the evidence and they are rotated, then yes, you can. But you got to look into that now before the application submission deadline. That's just the template. So post-foundation must consist of elective and emergency training in the specialty for 4 months. Post where on-call commitment in the specialty, for example, on-call duties undertaken concurrently with the research or teaching, are not eligible. You are on a research post, but you were doing on-call, so that's not counted. So less than 4 months, look at your options if you can combine the rotations. Publications, they would ask you for 2 best publications. So there is a strict criteria. It should be PubMed indexed. And this year they have included that it should not be pay to publish model. I'm not sure why they have stressed so much on the curious. I'm thinking just the curious may raise this point with the Health Education England, because you really can't do that without strong evidence. But what they mean to say is pay to publish model journals, they will potentially not accept the publications. And if they have mentioned the curious here, there's a good chance any curious publication will not be accepted. So if you do not have any other publication and you only have a publication which is curious, then no option, do submit and see how it goes. Maybe highlight the peer review process, and maybe you may have to submit the peer review communication, because pay to publish means the peer review process is not robust, which is true for the curious, but not always true. Sometimes it does go through the robust peer review process, and if you have all those emails, then potentially you can submit that. But yeah, to be on the safe side, if you have some publication which is not curious and it is PubMed index, then preferably submit that. Any articles which are not yet published, they say don't submit. You can submit collaborative papers, abstracts, letters, clinical tips, but obviously the weightage would be less. So one publication has 5 marks, but those 5 marks from 1 to 5 depends upon the impact of that publication, impact factor of the journal, the topic, how clinically significant area in clinical evidence that is. In many journals, you have to pay for the open access that is not pay to publish. Don't step back because you ultimately paid for the publication at the end. What they're stressing is pay to publish means you manipulating the peer review process by paying. So pay to publish is different from paying for the open access. So that's just the template you would have. So again, in the publications, if your publication meets the criteria in the template, what you need to find out is all the strong points of your publication from the list and highlight that in the template, because that's what will make the difference in 1 score versus 5 score. Presentations, they are asking you 2 best presentations. Any local or regional presentations are not accepted. National presentations or international presentations are accepted. Oral presentation, poster presentation, talking poster presentations, remote conference attendance and presentation, all the same category. So even if you presented a poster, it's accepted. Once, as is true for the rest of the criteria, once your presentation meets the broad criteria, then how much score you will get out of 5 depends upon the quality of presentation. So what I would say is, if you have any oral presentation, then yes, preferably submit that, provided it has a good content, high value content. But if you have no oral presentation, then obviously you can submit the poster only. But again, what would matter is all points about the publication. But in presentation, if it was a very good conference, for example, ASGBI or some well-known subspecialty conferences, do mention that, highlight that point. If it was a special prize session, do mention. And if you got the prize, don't forget to mention that, must mention. So any positive point that will differentiate your presentation from the others, must make sure that you mention that, because that would help you give the marks between the 1 to 5. Additional qualifications. So that is the point where they are becoming more and more strict, but still there is no hard criteria. They have referenced this publication, and this publication includes a lot of degrees from many different countries, which probably they would not accept. And the common degrees from many countries are included in that. What essentially that means is any degree that has been part of your training. For example, you did the training, took the exam, let's say, for example, FRCS. So if you took the exam in your country and passed, but that was part of your training, that will not be included. So if you have any degrees other than intercalated degrees, for example, you've done masters in education or masters in research or some public health masters or something, so do include those as preference, either masters or PG certification or PhD or MD, you will get the score, depends upon what kind of degree it is. But if you do not have, let's say, any extra degree, and your only degree is intercalated degree, you can still submit, but this year they are a lot more stricter. And another point, if that is clearly a degree that they have mentioned that it will not be accepted, and if you submit, they will reject it, your scoring probably would not be impacted per se negatively. But keep in mind, there are 5 score of general application. So if there is something very clear cut that's not accepted, then maybe try and avoid it. But what you can potentially do is get a eukaryotic alternative, like a equivalency certificate. And if you want to submit that, then there is a chance it can be accepted in certain category. So, but as I mentioned, this year, they are more stricter than the previous years. Sorry, it's stuck. Okay, so additional qualifications. If you have the additional qualification that meets the criteria, make sure you stress on the number of years, stress on the transcript if you have. If it was a dissertation or thesis, do mention that. Because if you submit as a PhD, but you do not mention the number of years, they may downgrade it to PG cert level or master's level. But if you do mention that it's a 4-year degree program, then you will likely to get the PhD level marks. So the integrated degree we mentioned, and we did mention the ACTIS, which is a kind of a new name for the UK NARIC. So regarding the templates, so these are all the 7 questions. Regarding the templates, so individual templates, you do not need signatures. Last year templates are not acceptable. You will need a new templates from this year. But the checklist needs to be signed. The rule for the logbook is different. For the logbook, you need individual pages signed and then make it as a PDF and then submit. And then as well, you need to get the checklist signed. It should be educational supervisor or equivalent. If you don't have a named educational supervisor, must put their GMC number. If you don't, the evidence will be rejected. And if the evidence is rejected in the first 3 questions, you will be withdrawn from the application. So be very careful. Last year templates are not accepted. Low threshold to reject the evidence. If template rejected in question number 1 to 3, which are mandatory criteria, you will be excluded. So be very careful. What does not contribute anymore is the work-based assessments, courses, prizes, leadership, management, teaching experiences. They would matter in your interview, in your leadership, as well as professional development stations, but not in the application. So you cross the bridge, go to the interview, then you can focus onto the interview. But for now, you need to focus onto the application. Very brief about interview format. It's not the focus for today. Focus for today is to cross the bridge of the application. But very briefly, it's online. It's not 17 to 90, sorry, it's the last year slide, but it's 26 to 27 March. Components this year are the same: clinical, management, and professional development station. Last year it was called as portfolio station. This year it's professional development, but essentially the aspects of your career to date is part of the portfolio development, professional development station. Must look into applicant guide. It's downloadable from Oriel. Trainee portal, our website does have some information. Must look into person specifications, which are essentially unchanged except for the GMC requirement. Medical specialty recruitment applicant guide. It is not and very helpful, but it does help in terms of oral aspects at times. And health education England website does have valuable information. That's our website. That's the Facebook group for the ST3 general and vascular surgery. If you guys are not already on, let me just quickly find out the link. So I will share the link in the chat. So this Facebook group, there are candidates who are now in training. They are part of the group and they actively contribute. So what you can do is put your queries in there and you can have the answer to your queries. And also you can find your buddies in terms of preparation. So the link is in the chat. Other resources. So we'll be conducting the interview preparation courses for both general and vascular surgery. So the courses are supposed to be live, but I have asked them to make them live today. So I'm sure they should have done that by now. But otherwise, the date for the course booking to go live was tomorrow. Let me share you the link. So that's the link to book the courses for general and vascular surgery. The dates are mentioned in there. And where are we? Goodness. So the question bank, if you book the course, you will have a complimentary access to the question bank. If you are already a question bank member, then your course booking price will go down automatically if you book the course after logging into your account. So let's go to the questions. There are questions onto the chat. Let me look into that. And if there are any further questions, we can take. What time is it actually? 9. So we are already a little bit over time. So let me go through that quickly. There are many questions actually. Okay, so I have separated, so that's answered. Can I just make one logbook for 3 years? Yes, you for the last 3 years. So it should be complete logbook for the whole of your experience. So yeah, you should make one. What about the EGS job? Is that counted as general surgery experience? So if it's a whole emergency general surgery, then obviously you're doing some elective rounds and everything. So that is counted. But if you are doing only emergency general surgery and you are doing something else like a research or something during your elective time, so that then it's not. What about endocrine surgery? It's subspecialty of the general surgery. How would we have access to the recording? Yes. What about the job that is ongoing, contract or permanent job? Usually don't mention the end date. So if it is ongoing till July 2026, then your experience will be counted till July 2026. So, but you just need evidence that you have a likely to continue till that time. Do we need to mention only appendectomies or other procedures as well? So your logbook will have everything, but what they will count is appendectomy only this year. Next year, they are planning to include hernia as well, but forget about hernia for now, only appendectomies. And if it's vascular, then appendectomy and femoral artery dissection. Should I only provide only general surgery cases for the logbook or every procedure? You have to put every procedure. Otherwise, your logbook will be invalid. It won't look like a logbook. It would look like a makeup logbook. So you have to complete your logbook. Are audits on VT and operative notes actually excused? No, that's what I explained. You need to find a novel element. or you need to find other audit. If operation notes were audited, again, new guidelines. That's what I mean. So find a novel element, not a routine audit. Will BTS risk assessment be considered novel? No, it would not be. So you have to find out certain things that, for example, younger patients you were seeing VTEs, or some new environment change, ward change, or something. So you need to find out a novel element to the routine audits. I have a close report from back from Pakistan, and I have a letter from the OG saying my involvement at every step at the start of the audit. Secondly, I have closed loop audit done in UK. I am only in the data collection analysis and presenting. Should I submit? So the second one sounds like it's not a closed loop, so it will not be counted. So you will have to submit a closed loop audit, whether it's from Pakistan or somewhere else, but it needs to be closed loop audit. While filling the application, should I include my foundation year or HOS job to start it after or start it? So you have to include your foundation in the initial part of the application. That's the way you have to mention, but that would not be counted as your general surgery experience. Any publications in which you have worked as data collector. So if you do not have any other publication, that's the best bet. Are case reports accepted? Yes, but if you have any other, then preferably put that, because case report value would be less. Which one is considered better, being a first author of a case report published in a journal with a no impact factor, or being a second author in an article published in a good second author? Video technique publication in a high impact journal, should I include it? Yes, you do. Is PLOS considered to publish? I'm not sure what PLOS is. But yeah, so if it's not very well-known journal, first of all, it has to be PubMed indexed. After that, it depends. If it's a very well-known journal, then no question. If it's not very well-known journal, then there's a good chance it would be accepted, I would say, because they are starting this thing this year. They will have to think a lot before rejecting any journal other than, obviously, Curious they mentioned. I have publication in Springer. Is it counted or need to be only in, not sure what was that. Only in PubMed. No, PubMed is not a journal. PubMed is the indexing body. So Springer may be PubMed index journal. So look into that. So PubMed index publications will have PMID, PubMed ID. I have rotation in plastic surgery at 2 different occasions. One occasion 2 months and other one in 3 months. Yes, you can combine that and have a benefit of the rotation. Yeah. In presentation section, can I include the presentation, oral presentation for the same audit? Even including, yes, you can include the same audit in the audit section and presentation in the presentation section from the same basic data. Yes, you can do that. But if single data has given you 2 publications, you cannot do that. You will have to choose which one you submit. But in public presentation and audit, you can submit. Can I mention Master of Surgery, Cardiovascular Thoracic Surgery, which was a 5-year graduate degree in Bangladesh? Will I get scored? Probably not. But if you do not have anything else, do mention your years and thesis and examination and hope for the best. But probably not this year. If I'm still in the master's curriculum, but still did not do thesis, and I have got papers noting that I'm still doing it. So if you are a master, but you have done more than 2 years, you will get a PG cert scoring. If you are not completed it, but completed 2 years. I got master from India, got UK NAR equivalent certificate as well. Also, I have a PG cert in university in UK. Which should I do in this case? PG cert in UK, because master's is part of the intercalated degree along with the surgical training in India. So probably it's a very well-known degree. Probably this year they are rejecting that. So I would recommend PG certificate. What if my degree is overseas, master's, but I finished in it in 4 years? Do they consider? So if it's a degree, it's not integrated, it will be considered. So 4 year qualifies as MD, yes. Is the residency overseas counted as general surgery experience? Yes. And will it affect my score? Yes. And if I wrote down as I have more than 3 years residency, yes, it would. But what you can do is, if you have, let's say, 3 year residency, but you are rotating, let's say, in urology or orthopedic as part of your training, so you can exclude those months from your whole 3 years, if that helps you. And then the links in evidence question 1, do we have to provide all the evidence from FY12? No, after foundation year. So just general surgery experience after foundation year. Experience colorectomy with on-call general surgery will, what was that question? Skip it. Experience in colorectal surgery with on-call general surgery will not count towards general surgery. It will count because colorectal is subspecialty of general surgery. For logbook evidence, is it just the consolidated sheet or consolidated sheet and every page? So every page, they mention every page when you're making the PDF. And signed, every page signed. Is logbook necessary? Of course. Do we basically create a consolidated report with parts of a procedure that reflect, for example, femoral dissection, highlight that and get it signed? So consolidated sheet is also acceptable, they mention, but at the same time, separately, they mention the each page
No.
to be signed. So if you can get each page signed, then obviously that's preferable. But consolidated sheet mentioning each operation
It's about
is acceptable. Somebody's mic. Next is, should I only provide only general surgery cases for the logbook or every procedure? Otherwise, it's not a logbook. UK audit is closed loop? Question mark. My question was which one to include, UK or Pakistan audit? If UK audit is closed loop, then you include the closed loop UK audit. That's more weightage. And obviously it depends your involvement and clinical impact and everything. But if both are more or less similar, but one is from UK, one is from Pakistan, include the UK one. If the article is accepted for publication in PubMed Index Journal, but PubMed ID is pending, will it be accepted? Yes, it will be. If it is accepted, you have a letter of acceptance, then it will be accepted. Will, while generated consolidated sheets, did date, Mr. What is that? Mr. number is mandatory. While generated consolidated, sorry, Basit could not get what you mean. PG certificate from Royal College of England, should I include? Yes, of course. Can you mention curious publication again, please? Submit or not? So if you have any other publication, then do that. And any of the 2 publications, because they've asked you to. But if you have only curious publication, no other publications, then do submit that. But you need to make sure that you highlight the peer review process, because it is the peer review process that makes them reject the curious. If you show that it has gone through the peer review process, then there is a chance it may be accepted. For my MDs, I'm looking in different markers in pancreas rejection. The results for each biomarker were presented separately in different conferences. Will this be accepted, or is it considered coming from the same database? So one publication or one presentation or one publication from the same data is accepted, not two. I currently have a teaching fellow job. Do I need to include that contract anywhere? Teaching fellow, but is it clinical involvement as well? I presume it's a percentage. So you will need to include the percentage of your clinical involvement. What is it? Sorry. Maybe it's just the background noise. Okay, I think we are quite late on time. Can I upload evidence from both masters and PG certification? Well, you can, but this year they have mentioned contingency arrangements in the application. What that means is, if due to certain reasons they do not find the consultants to review the scoring systems, then they will just see your first evidence, whatever comes up, PG cert or masters, and they will score that. They will not look into your second evidence. So what I would recommend is, what you think is the best, submit that. Don't leave it to them to decide. I have registered for the interview prep course. I have received a confirmation. However, the course is not appearing in my training portal account. Will this be an issue? Do I need to do anything? Did you register now? Probably because it's just gone live. But the admin team will look into it and just drop them an email if there's any issue, and they will sort it out. So, but if you have registered, you received an email, then that's it. You have your slot. My country does not provide formal contracts for the doctors in the public sector, but I have letters from each consultant I have worked with dates of working with them. Is that acceptable? Well, there will be a lot of letters, but yeah, if that's the only thing, then I don't see any reason it would be rejected. But uh, obviously, if you have a single contract that mentions degrees, the dimension rotations, then that's a different thing. But yeah, otherwise it's acceptable, I think. So we need every pages for the logbook or just consolidation sheet. What I understand is consolidation sheet mentions each operation and number you have done as supervised, unscrubbed, scrubbed, or but they do not mention individual appendectomies. Consolidated dation sheet is acceptable, but if they raise any query and they do not find background evidence, then they may raise a question. They will probably, if you submit consolidation sheet along with individual pages, they will only look into consolidation sheet. There is a good chance they will not go any beyond the consolidation sheet. But if they have any question, but you have a underlying evidence as well, then it's a kind of a foolproof. While generating consolidation, date of operation and hospital number is mandatory. No, hospital number is not mandatory. Date of operation, not sure. But what they need is the index, like a consolidation sheet of the number of the procedures and what you performed. Date I'm not sure, or maybe because they may want to match it with your general surgery experience. So maybe worth putting it, but I'm not exactly sure. If you submit QC publication, won't they down mark in the 5 points for the organization? It should not, because you are trying to give them the details of the peer review process. But very clear, if your curious publication has gone through without peer review process, then obviously that's not no go. Then don't submit that. Do COVID years count? Well, if you have experience, then they do count. In my experience certificate from abroad, my general surgery experience is mentioned along with my rotations as well. Should I attach a separate general surgery certificate? No, if they mention separate dates for your general surgery experience, like you started this date, finished that date, then that's completely fine. You do not need a separate general surgery certificate. Is logbook necessary? Oh, yes, of course. Is research fellow in colorectal considered as general surgery? Yes. Is research, oh, sorry, research fellow. Yeah, research fellow is a clinical job. It's not kind of a only research, but it depends. Some contracts have a percentage clinical involvement, 70%, 50% or something. In that case, it could be up and down depending upon your percentage involvement. I think we are running a lot behind. Is a research fellow with regular elective add-on emergency work is done? Add-on emergency work is done. Can they be counted as experience? No. How to mention this? Because contract says research. So if it's only add-on emergency work, then no. If it's not part of the contract and you are doing, for example, just locums, so no, then no. My hospital is not in the logbook where I have worked for 3 years. Can I make a separate logbook? If it's outside country hospital, then you can include your hospital name in your logbook. There is a way to do that. And then you can put your cases onto that. My experience was over 7 years, 4 years as a resident, 4 years surgical specialist. Can I need one logbook? Well, I mentioned before, if you have one logbook, that's better rather than 2 logbooks, because if they are confused, they will only look at one logbook and give you marks based upon that. I have a few queries about the vascular application. It is quite different from general application. Yes, it is, and we'll be looking into that. Maybe go this place. Okay, all right. So I think there were many questions. We have gone significantly beyond I apologize to the vascular candidates who are waiting for the vascular application. But in general surgery application, if you have any questions, you can always put query into our Facebook group. And I am part of that group and I will try to reply. But I have one opinion and I can reply from my experience and my assessment. But on the Facebook group, there are many people who have been through the process and they can also give their opinions. So feel free to put queries on the Facebook group as well. And stay in touch. Wish you guys all the best and hope to see you soon. And do let us know if any questions. So okay, all right. So I will close it for the general surgery now.